under God, indivisible, with liberty and justice for all.
Thank you. If Teresa would call the roll.
Commissioner Matthew.
Here.
Commissioner Hoffmaster. Commissioner Houts.
Here.
Commissioner Leininger.
Here.
Commissioner Baker.
Here.
Commissioner Lanius.
Here.
Thank you.
5 members present, 1 absent. That is a quorum. Item 1C, approval of the agenda. We have an agenda before us.
Move to approve as presented. Second.
Motion by Commissioner Houts, second by Commissioner Baker to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Approval of the minutes of the May 25th, 2023 Board of Health meeting. Those are in the packet and were available for review online prior to today's meeting.
Make a motion to approve the minutes as printed. Second.
We have a motion by Commissioner Baker, second by Commissioner Houts.
I'm on a roll this morning.
To approve the minutes as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, say nay. Motion carried. Public comment. This is the first opportunity for the public that is here, or if anybody has submitted written comments, to speak to the Board of Health. We remind the public of our rules that have been adopted by the board and our bylaws for that public comment, and each speaker is limited to 3 minutes at a time. Is there any public comment? Hearing none, we will proceed forward. Health Officers report. Good morning, Becky, and it is good to see you today, but again, you know my thoughts is to, our thoughts are with you and your family.
And we appreciate that very much. Thank you. So I did note as I was going back through my report that I sent to Teresa that there is no Board of Health Education today. That is a holdover from last month, so you can strike that from the first page. But I'll start at the beginning. So regarding public health accreditation, which we did here in April, the end of April, those reports are now in. We shared that information with the Program Policy and Appeals Committee at their meeting yesterday, and they are available to all of you on our agency website down under the Resources tab. So if you wish to take a look at them, they're available for you, they're available to the public. Anyone can access those reports at that location. Overall, we learned a lot. We had a lot of new staff members on board for this accreditation visit. Many of the staff have never been through accreditation before because they are new. And change for this cycle of accreditation is that they did not score the minimum program requirements with not met or met with conditions. They simply provided technical assistance reviews. So some of those reviews were helpful in that the accreditors looked at materials like they would at a normal review, whereas others just kind of came down and said, so how you guys doing? We didn't think that was terribly helpful, and that's been relayed back to MDHHS as well as MPHI, who leads the accreditation efforts. As we're the second local health department to go through accreditation in Michigan, we hope that our comments will help to improve this round for other health departments that have yet to go. Just wanted to note that we continue to work on the objectives in the strategic plan, and we'll continue to provide you with updates every 6 months. Personnel Policy Committee, they've been working hard on some of our procedure documents. We've completed the exposure control plan, chemical hygiene plan, and medical waste plan. Those are all finished now. They've been shared with the staff, and will here on forward receive an annual review using our performance management software. They are also continuing to meet to make updates to the personnel policies. especially regarding how we respond in emergency situations. We may be bringing you modifications to the personnel policies prior to the beginning of 2024. That's usually we do once a year, but because there are some changes to how we're notifying staff, if we have weather emergencies, for example, it seems that we probably want to bring that to you a little bit sooner this time. So I would expect that will come before program policy and appeals shortly. The website has been receiving some attention here at the health department. We have a committee of staff that are working on how to make that website more user-friendly. During our community health needs assessment work that was done by the contractor that we hired, some of the feedback that came back to us was that people really don't like our website. They find it very difficult to use, and so we took that to heart and have been trying to implement changes to that website that hopefully people find helpful. We don't consider it at this point to be never to be touched again. So if you are taking a look and have feedback for us, we will continue to update our website to hopefully continue to improve it. Our EH software implementation, and Paul may talk a little bit about this today, is really going well, and very happy with that contractor. Program policy and appeals also talked about the community health needs assessment and the community health improvement plan at their meeting yesterday. That work has been wrapped up by the contractor. He has finished his work at this point. All of the human service groups in the counties, they all have slightly different names, have all received a final presentation, and we have some strategic objectives now to work on as a result of the community health improvement plan. We have Hillsdale Hospital interested in a rental agreement to utilize our mobile van 2 to 4 times per month is kind of what they're proposing at this point. So we've touched base with Andrew Breggy, our attorney, about such an agreement, and are working currently with the hospital to come up with an agreement that works for both us and them. This will allow Hillsdale Hospital to get out into those smaller communities in Hillsdale County that are quite far away from Hillsdale, and provide clinical services. Because there's no county transportation in Hillsdale, that is a barrier for some people to get to care. So we really see this as a win-win for the community.
What kind of services can you provide with that van?
Well, it's outfitted for like a medical visit. So it has an exam table, it has a lift so we could bring people in a wheelchair. It does have refrigeration, onboard generator. You could really, as long as you bring the supplies that you need with you.
Probably can't do an appendectomy or anything
I would
like that
not do
in there.
surgery in it, no. But I would think you could certainly see patients on a normal routine visit, and even for somebody that's got an issue that they need addressed. So we'll keep you informed as that moves along, but I'm pretty excited about it. I think it will really benefit Hillsdale. Why not Branch? Why not St. Joe? There is public transportation in those communities, which makes it a little bit easier for people to get to medical doctors. Also, those particular hospital systems haven't approached us at this point, whereas Hillsdale Hospital has. So Hillsdale also has a rural hospital designation of some sort, which allows them to capture a higher repayment rate for seeing certain patients, which may make that more of an option for them than other hospitals. We did hold our agency staff meetings early in June, so we've done our quarterly round there. The wildfires in Canada and Michigan have certainly created a lot of concern with unhealthy air, and we have had some meetings with MDHHS to talk about messaging to the public and protections that people can take especially if they're at risk for respiratory distress. So the good news is that, you know, one of the things I guess we learned through the pandemic was that, you know, we need to have these meetings and have these communications early so that we can get the best information out to the public. Our annual report is complete. I've done the presentation at St. Joseph County Commission and am scheduled to do Hillsdale and Branch County next week. Medicaid redeterminations, during the pandemic, individuals on Medicaid were not reviewed, their cases were not reviewed annually as they normally are. Now that that emergency is over, all of those individuals on Medicaid have to be reviewed and determined if they still qualify for Medicaid. This has caused a lot of concern from those of us that work with the public about individuals losing their Medicaid because they maybe have moved and they don't receive the information that MDHHS needs updated information from them, or they just don't answer their mail, or whatever it might be. Continue to work with our local MDHHS offices to understand what's going on and how we can help to support. We've got messaging on our social media and on our website about this, and that we have staff here that can help people with their MyBridges accounts. All right, as far as the buildings go, here in Coldwater, the removal of the overgrown bushes is completed, and they're going to remove rocks and seed up to the building where those bushes were. In Hillsdale, if you guys have been over there, the upper lots are paved at this point. The lower lot, when I was there on Tuesday this week, is was dug up and getting prepared for its new surface. So that's moving along well. We also have received notification that our elevator is going to need some additional safety equipment that's required by law. And the company that maintains our elevator has informed us of this change and given us a quote. It is a significant expense. It will require board action.
Automatic backup generator?
No, it is safety equipment. Do you know, what would you call it?
It's an override so that the car can't move if there is a controller malfunction.
Somebody died in an elevator somewhere, and so this is a requirement as a result of that. So, if you have an older elevator that doesn't have, I don't know, ours is an older elevator and it doesn't have the equipment that just allows them to make a couple of switch changes. So it requires a significant upgrade. You may face this in Hillsdale if you have older elevators in some of the buildings and also in Ranch and St. Joe. But the quote we got was like $29,000.
Yeah. And so the elevator will not move if the door is not closed. And the control panel looks for that connection, but it's a backup to make sure that if there's a failure in that the elevator will move.
We will bring that to the Finance Committee, but it didn't make it to this Finance Committee.
When were you notified on it?
Like 2 weeks ago, and I'm still working on doing some discovery on it. I asked for additional information from the vendor, and it does appear that the last iteration of this particular law didn't go backwards. It only affected anything that's forward. This iteration, 17.3, goes backwards as well.
And we use Schindler.
Yes.
Yeah. And they were paving the lower lot yesterday,
All right.
so.
I would guess by the first part of next week, they'll be driving in. Should be
Is there another company that we can get a bid from? I mean, it's pretty,
We can try.
Well, the issue on that may be though, because we have a service contract agreement with Schindler already on that elevator, that any work that's gotta be done on it's gotta be done by them as part of that service contract agreement, and again, I don't know.
Another
the
thing that
legality of that wouldn't work. I signed a lot of service contracts, you can't make someone use you for your service.
Also, I think there's state requirements for certification to be able to work.
For
on
sure
this.
there is.
There aren't a lot of companies that do this work.
That narrows it down.
Yeah.
Yeah.
And I know Hillsdale County uses a different company than the one we use.
Well, Hillsdale's just stupid.
They don't even have transportation.
All right. So that's coming. We'll keep you informed on that. In Three Rivers, so good news. The contractor notified me this week that the materials that they ordered are in. And we have paid for the first half of that job, so they should be getting started really soon. In Sturgis, that additional space project is continuing to move along. And the finance committee met to talk about a proposal the landlord provided to us for a modification of the lease. And at this time, that is all that I have for you.
Okay. Any other questions for Becky at this time? Okay, hearing none. Medical Director's report, Dr. Lucarello.
Good morning. My report, it's about the same as the other months. However, there's lots of new treatment protocols that we're kind of looking at for STIs, and lots of things are changing because of some shortages in some antibiotics, et cetera. So that was the meeting I was on this morning. And they are also forming a task force at that level about the air quality as well. So people are kind of learning from COVID and hurrying up and trying to form task forces to get the right information out to the whole state. So that would be helpful. My class is this semester doing an accelerated summer class in communication, and my practicum, which is a project on the sexually transmitted infections, especially since they're on the rise in our community as well as other communities throughout the state. So Rebecca is serving as my proctor for that, which is so nice, and work is getting going. So interestingly, I have to go through some review board to be able to review our charts. So I hit a little snag there, but that should be accomplished pretty quickly. And then my education for this month, I decided to focus on one of the June, seems like the months are just expanding. Like every month used to have one health focus, and now they have 5 or 6. So one of them for the month of June was Alzheimer's. So clearly a public health issue in many respects, as Laura knows. It's the patient as well as the caregivers. So if you've ever experienced any of that, the caregivers are almost the harder part, right? So it's a progressive disease, obviously destroys memory and other mental functions, and there's no cure. We do have some medications that are now able to delay some of the symptoms, but there is no cure. So when you read the statistic that 6.5 million people in the U.S. age 65 or older live with Alzheimer's disease, it's a little frightening. More than 70% of those people are 75 and older. And then the causes are very difficult. No one really knows, right? We think it's a combination of age and a combination of your lifestyles and some age-related changes in the brain. And researchers are looking at 2 proteins. So you'll hear sometimes the mention of plaques and tangles when you read about Alzheimer's disease. So there are several risk factors. Clearly age is a risk factor, right? Being a little bit older. And the more recent studies found that there were 4 new cases per 1,000 people aged 65 to 74 every year. So, you know, we kind of, every day. So we're kind of just increasing our numbers because we're also living a lot longer. So family history and genetics is a risk factor. If you have a first-degree relative, your risk is a little higher. And they're looking at some genetics for that. There's a gene that we can identify. However, some of us carry that gene and will never get Alzheimer's. So might be one of those things pretty soon we can find out on 23andMe, and I don't know if we want to know if there's not a cure. So I'm not sure if I want to know. And I have some relatives, so runs in my family a little bit. Down syndrome is interestingly related to Alzheimer's because it's the same chromosome 21 that makes some of those proteins. So unfortunately, some of the Down syndrome patients also end up with some Alzheimer's dementia. women are more prone to get it than men, and sometimes we think that might be because women just live longer, so maybe we're living longer and therefore we see more Alzheimer's. Patients with mild cognitive impairment, so patients who can function, maybe live alone, but are a little bit developmentally delayed, they are more at risk as well, and we think that might be because one of those proteins has been affected. And then head trauma, which we've all read about in the news lately with boxers and football players, and so there's an increased risk if you've had more than one concussion, more than one closed head injury, that you might be at higher risk for Alzheimer's. Air pollution, wood burning has sometimes been associated with it, and traffic. So that's another benefit of living in a rural community. Maybe we have less traffic and less air pollution. Alcohol consumption, poor sleep patterns, and then all of those things that we talked about with lifestyle and heart and wellness. So if we're not getting exercise, if we're obese, if we smoke, if we have high blood pressure, type 2 diabetes, all of those things have a higher risk of Alzheimer's. And then I thought the interesting one that we can control some of those heart-related things as well, but our social interactions. So they're finding that people, there have been lots of great studies on this, people who stay involved, people who get older but they still stay involved in reading clubs and card clubs, and they have family that comes over and they talk at the dinner table, and they maybe play some card games on their computer if they're alone, they do some board games. Those patients can lessen the risk of getting Alzheimer's. So you can imagine, and we probably all experienced this, that those patients can't even tell us if they're in pain. They can't tell us if they have any other symptoms. We might give them directions for a simple urinary tract infection to take some antibiotics. They can't really follow those directions because they can't remember those directions. And they can't explain any side effects to anything we're giving them. So their risks, they fall, they have fractures, they end up with bed sores because they're not moving, they aspirate food, lots of dental issues with Alzheimer's patients because they can't tell us if their teeth hurt, right? And we don't frequently look at our patients' teeth unless we're in that line. So all sorts of difficult things for the family and for the patient. So again, not preventable, but if we follow all those heart health things that we talked about very similarly, Mediterranean diet and getting some exercise and losing some weight, not smoking, controlling our blood pressure, then hopefully we can lessen our risk of Alzheimer's. And there are, again, some great studies on that. So if you read the scientific literature, it would make us kind of join some reading groups and card groups and stay active and be on some committees and have that social support that Laura frequently talks about when she talks about our area on aging, the work that we do. So really important. And we don't have very many resources in Hillsdale County. I mean, we have our area on aging, but I worry a lot about the caregivers and the family members. We have a few support groups, but I will frequently even see some patients sitting in the car in Walmart that I know have some dementia, and their family member is running in to get some groceries because they just don't know what to do with the individual with Alzheimer's, and bringing them into Walmart is just sometimes too much and too much input. So lots of public health implications for our Alzheimer's patients. And I think that's all we have today. We'd like to bring a cheerier health topic, but it doesn't seem like that's in existence lately.
Any questions for Dr. Lucarello? Just one I've got. Any equine encephalitis?
I have not heard of any, nothing, right?
Thank goodness, it's pretty early in the
Yeah, it's
season.
still early. I was thinking the same
That
thing.
tends to be later in the fall.
And we haven't had a lot of rain, so there haven't been a whole lot of
That's
mosquitoes.
a very good point.
That's one benefit.
Vaccinate your horses, please. That'll help too.
All right, moving on. Department reports. Ms. Sutter, Area Agency on Aging.
Good morning.
Good morning.
Great report, Dr.
Thank
Lombardo.
you.
The notion of respite care is not necessarily a battle that we have with caregivers, but caregivers tend to want to do it all. And when you have a loved one that has dementia or Alzheimer's, a lot of times sort of giving them an introductory sort of few hours each week just to do one thing. We try to encourage people, just do one thing. Go to Bigby, grab a cup of coffee. We will sit here with your mom while you go. And that gives them, in brief, short stints, the opportunity to take a breather and let go of that duty that so many families feel that they have. So I appreciate you illuminating the topic, and if anybody has questions, there is a statewide coalition that's been active for many years called the Dementia Coalition. So researchers and social service agencies and other professionals gather to come up with a dementia plan, and the state of Michigan is pretty progressive between our 2 universities, the larger universities, and some smaller. We have a lot of dynamic research being done and efforts to support caregivers in their role, because as we all know, those folks don't get compensated for that care, and it's one of the most difficult jobs that there is, especially if you have younger kids at home as well. So our Services to Victims of Elder Abuse program is going quite, luckily Wendy has picked right up and has participants. We are still receiving 3 to 4 referrals a week, and have served more than we have last year, just through the end of the second quarter and into the early part of the third quarter. So very, very pleased with not only our collaboration and our networking, but then the referrals just keep coming in so that we can help support people through their trauma. Our agency nominated an organization in St. Joseph County that is a collaboration among faith organizations called Hope United. I did link it in my report a couple of times. I hope you'll check the website out. It is a very dynamic group, and so we decided, because we've worked with them on a number of instances, to support our victims, because they have a quick response and they are not, they don't have only so many things they can do. If we feel like they have such a broad brush of support and volunteers that they are doing and supporting people in ways that other organizations cannot, or maybe their funding limits them from supporting and doing different programs. One of them is like hauling personal items. So if somebody needs to move and move quickly, if you don't have the money to pay for an actual moving company or a friend or have other family, you're really in a pinch. And so this organization, especially when you're dealing with victims of abuse, neglect, or exploitation that need to have things happen fairly quickly, we've been so very lucky to have connected with them, and they've really helped a lot of people. So we thought it was a great opportunity to nominate them for their efforts, and the Prosecuting Attorneys Association, as well as the Department of Health and Human Services, and the Elder Justice Coalition have a summit every year, and they've engaged that group, and so we'll go on July 20th and see if they get an award. It would be great if they did. They're reaching into Branch County as well, and I know they have done work over in Cass County as well. So, and it's not just older adults; it's families, it's individuals, it's people who have mental health and substance use disorders. They support them and try to give them the dignity of picking out items if they're trying to reestablish their life. They have a free store, so they let folks go shopping, which I think is very a dignified way to help people get back on their feet. The plan is set to go before both Branch County and St. Joseph County, so I'll look forward to seeing you in the next couple of weeks. We'll be submitting that online in the planning sort of functionality of our aging information system before the deadline on June 30th. Had a great time partnering with Health Education and Promotion at the Water Festival alongside those folks at the Water Festival. It was warm but very busy and very fun, and it was a neat opportunity. We haven't been in a number of years. We'll be hosting our field representative from the Bureau next month. So, just like we check our providers for compliance with state and federal standards, they check us to make sure we're following all the federal and state standards as well. and then how we're doing with our plan objectives for this current year. And then we're still sort of in the middle of all of our provider assessments. Just conducted branch area transits yesterday, and the Commission on Aging is next. So once we have all those complete and have a summary for the board, we're hoping to have that shared in August. Any questions?
Any other questions? Okay, thank you.
Sure.
Mr. Alex, Health Education and Promotion.
Good morning. I really don't have a lot of major updates from the previous meeting. Isabella Stikos, our new health educator, started on May 8th. Obviously, she's still kind of learning the role, but we're very excited to have her on board. She's been helping a lot with redoing a lot of our social media posts and everything else, and trying to get the word out there and trying to get people to our pages and more people to follow us. She actually came up with kind of a funny idea, but we had some old ducks that no longer floated that we used to use at events for children to pick, and it was a prize thing. She used it as there's a bucket out front, picked a duck, it had a duck name on it that we came up with, and anyways, you followed us on Instagram or Facebook and you were enrolled for a grab bag prize. So that actually got a 10% bump in not only views on Facebook and Instagram, but 100 plus more followers pretty easily. So we're gonna keep doing stuff like that, not only here at this office, but also Three Rivers and Hillsdale. We continue to post relevant stuff on social media sites. Some of the topics for May were Nurses Week, EMS Week, Hepatitis Awareness Month, Stroke Awareness Month, Mental Health Awareness Month. There's a lot of stuff they throw into all these months. Older Adults a Month, Women's Health Week, Summer and Heat Safety Week, and World No Tobacco Day. Yeah, they should spread those out. We're also working to update the agency's brochure. It's been a couple years since we did it last, so going back through it, making sure services and everything are correct that are in there, and then kind of just updating a little bit for visual appeal. The Medicinal Marijuana Operations and Oversight Grant, I think I mentioned it at the previous meetings that we were finalizing a lot of the large scale projects and promotional stuff that we were planning on doing. That's still moving along. The work with the Branch Area Transit Authority, we have the design has been approved. We're working with Tucky Auto Sports, Motorsports, some sort of sport. They're going to be doing the installation and printing of the actual design, so that'll be going on the bus later this summer at some point. As of yesterday, which is kind of exciting, our billboard in Hillsdale County is up. It's at the intersection of State Route 99 and Beck Road. So if you're over in that area and you see the giant Lock It Up design, that was us. Our commercial that we are worked with Comcast to get airing on streaming channels and live TV to a certain extent will begin at the beginning of next month. And after we kind of purchased all of that stuff, we realized we had some funding left. So we used to purchase a lot of the Lock It Up boxes. We switched to medication bags last year. Didn't think we were going to be able to purchase them this year. We did end up getting a small quantity of them. We'll work with different county substance abuse task force to get those out. We'll also be handing them out at the different, summer events that are coming up. Our community health worker program continues to go well. Rachel, our CHW, had 19 active cases last month, which is actually the highest amount she's had in any given month. So she's definitely keeping busy, which is good. I think I mentioned last meeting, I'll mention it again, the funding that was provided for this grant has been extended through May of 2024. So we'll be able to continue this program. We hope to continue it past May of 2024, but for now the funding is there for us to keep it going until then. And lastly, just some of the events that we have been at in the month of May and some upcoming ones or ones that just happened. May 11th, we attended Lifeway's celebration event. May 13th, we were at and this was actually a really awesome event that was well attended. St. Joseph County United Way held a Be Here Tomorrow suicide awareness event. It was an awesome turnout, amazing event, so that was really cool to be a part of. On May 30th, I was not, but Rachel, our CHW, was at the Dr. Seuss read-along event, which was hosted by Sturgis Head Start. And then, as Laura mentioned, the 16th and 17th of this month, we were at the Waterfest in Three Rivers, and Tuesday of this week, we were just at the Hillsdale Safety Fair, along with our new emergency preparedness coordinator, Chris Dewey. From what I hear, amazing turnout. It's the first time they ever tried to do it, but I've heard good things. That's all I got. Any questions?
Any questions for Alex? Okay, thank you, sir. Moving on. Mr. Nichols.
Good morning.
Good morning.
I'm pretty uneventful this month as well, which I find to be a good thing. Two exciting things though.
Kids are out of school. Less diseases going around.
We have hired 2 nurses, so very happy about that. So pray for us that all works out well. So one in St. Joe County from a retirement that occurred, and a mobile unit nurse. So very excited about that. They will both be starting in July. Have a few communicable disease updates for you. Let's see here. So for avian influenza, so activity is lower this year than it was last year, so that's really good news as well. Still concerns with Mpox going on, especially with being the summer season with events and festivals, Pride Month. So concerns with resurgence in that, so we have done some messaging and social media awareness revolving around that. And I've been working with some of the team to update our website and some of the clinical sites to make things a little bit more accessible for people to find for clinical services, so that's been going really well. I did include some information here on the wastewater dashboard. This, I believe, is kind of like a partnership with U of M that's going on. Definitely not a subject matter expert in that whatsoever, but it's a very interesting form of surveillance, and they've expanded that to include Mpox. So I did include an article there for you if you want to look at some of that research that's been going on with U of M. And then there's also an infographic in your packet that kind of explains the difference between individual case surveillance and population level wastewater surveillance. So wastewater surveillance it can capture asymptomatic infections. It's best used to complement current data that we have, but can also provide data that's independent of people who are not seeking health care and testing processes. So it's a really interesting article, and so I'd encourage you to just look at that, because they are trying to expand some of that surveillance, and it could be a really useful public health tool, monitoring that way. Let's see, June 27th, throw another event date in there for the month. It's National HIV Testing Day. So we did put out a press release for that to encourage testing in the Tri-County area, and then you can request appointments on our website for that, and we also do HIV curbside testing as well. Let's see here. For WIC, our WIC coordinator has had some brief conversation, or has overheard some brief conversation and some meetings on possible updates to waivers after August. So right now the requirement is in August that all WIC clients are in person. But now that we have been remote for so long, there could be potential adaptions to that. Very little information on that right now. It wouldn't be as extensive as it was during the pandemic, but once we know more about that, or if we ever end up knowing more about that, we will be sure to update you. And then our Project Fresh is here. So this is a program that allows our WIC clients to get fresh fruits and vegetables at farmers markets. So that's been going really well. Let's see. I think that's pretty much it for me. Happy to answer any questions that you have.
Does anybody have any questions for Ms. Nichols?
I have a question. Page 15, number 11 from the base, novel coronavirus. We had in 21-22, we had almost 17,000. And 23-22, we had almost 1,300. Then, according to a report, in 22, almost all our 3 counties, little over 20 each. How do you get this report?
The column is, the first column is for the month. The second 3 columns is year to date, the current fiscal year.
Correct.
How do you monitor?
Where does
You're
the
not
data come
following up right now.
Oh, like where does this data come from?
Yes.
So there's the Michigan Disease Surveillance System. So this is a system that we use at the health department where physicians, labs, child cares all have to report communicable disease by law to this system. So it gets reported to us, and I pull the data from that system to create this report.
I don't know whether I should ask or not. If I am wrong, please correct me. Do you have any coronavirus death reports?
Death?
Yes.
Not off the top of my head. I can't give you any reports on that data right now, but yes, it can be accepted.
All 3 counties. I would like to know in order to compare 21, 22.
Sure. Yep.
Trending, yes.
Thank you.
You're
Thank you,
welcome.
Mr. Chair.
Yes, a couple of questions I've gotten in regards to the same page. We've got an increase in the chlamydia reporting, and also hepatitis C, acute. What's going on there?
Yes, chlamydia was very high in St. Joe County, but just as a reminder, that's more testing that's occurring. So even though the numbers look high, it's not necessarily a bad thing. There could be more promotion that's going on in different areas with testing. I know we try to encourage testing so we can get cases taken care of, because most of the time that can remain undetected if people aren't testing. In hepatitis, yes, there has been an increase. I don't know off the top of my head, without looking at some of these cases, if I can give you more extensive data on that, but I'm happy to follow up with you.
Yeah, what's causing it, you know?
Yes, I know that there have been some recalls, a lot of recalls lately related to hepatitis C. We usually get notified though if that's any connection to people that we have in our counties. And I haven't received anything like that from MDHHS yet, so I'm happy to look into those further and give you more detail.
Okay.
No, we're not alone there too. We're seeing a rise in hepatitis C throughout the state. And there have been some state programs to bring some treatment right into the health department. So I've been in on a few of those committees, and it might be a lot for us, but it's something we're looking into. So right now we refer those patients to either GI or infectious disease to get treated, and we do have a very good referral pattern for those patients. So I feel like we do have a good plan in place, but there are some health departments treating right there, you know, so we're kind of looking into that too.
Okay. All right, thank you. And Environmental Health, Mr. Paul.
Good morning.
Good morning. The computer program's working great and
We are
staff are
making,
loving it.
we are making really good progress. So impressed with the staff from Hedgehog. We've been meeting at least weekly. A lot of times we've been meeting a couple of times a week, working on different projects. And right now we're working on next week actually we have a meeting come up where we're going to do data validation. So we're just making sure that all the historical data that we're bringing up into the new system is what we need to be. We found that, or they found, and I guess we already knew that a lot of the data that was in health space previously was a lot of duplication. So we obviously want to get rid of that and get all those duplicate records out of there, so we have a really good solid database. So we're moving along really well with that, and we are definitely on track for our go live date. So I'm really encouraged with that. Other thing happy to report on is we have our staffing. All our open positions for staffing have been filled. We had one gentleman start just this week. His name was Jay Makala, and he took over one of our Type 2 non-community program coordinators. He took over a position that was held by Emily Moats. Emily is still with us. Emily moved over and took the food sanitarian position that was open when Carrie Southern retired here last month. So Emily was really interested in working in the food program. So we had the opening in Type 2, and Jay started started working this week, and is doing very well. He comes to us with a lot of experience. He's a Purdue graduate and has worked in public health and a significant amount of work also in the public sector in related work as far as health fields. So we're really happy to have Jay on board. We also hired Olivia Jacobs, who is a recent graduate of Lake Superior State University, the program up there. It's actually the third person that we've gotten from Lake Superior State, and so we're really pleased that we're getting some good candidates out of that school. And so Olivia will be starting on the 3rd of July, and she will be working out of the Hillsdale County office in our half-time position. So it's not half, it's 50-50. So working half of the time in the food program, half the time in the field program. So we're really happy to have those positions filled. Yes, sir.
How do you get somebody that just graduated from Lake Superior State to move to Southern Michigan?
She's actually from the area.
Okay.
Not so much this area, but she is apartment hunting as we speak. But she was a native of Lower Michigan before, so yes. Yeah, that's a good question. So actually, Ben Alberts was one of the one of our sanitarians that we had from Lake Superior State, and he was actually a resident of Plainwell, kind of where Becky lives. And we have Bethany, but she's a Youper. She was born and raised in the Marquette area, but she was happy to move down below the bridge to work for us. So we're happy about that. Other things I wanted to update you on. Last month I reported on the sewage leak that we had, the sewage and the break in the sewer line between Constantine and Three Rivers that caused a considerable amount of sewage flow. We were able to get out there and sample 3 residential wells that were potentially impacted by that spill, and all of those samples came back as non-detect for bacteria. Eagle is continuing the investigation, and they have been getting some information from the city of Constantine as to potential chemical factors that may have been in that sewage as well. So they may be doing some more sampling. Again, the lead on this is really with Eagle. we're happy to help out and take some water samples when we can to help them out. But they're continuing their investigation, and there may be some more sampling that's going to happen down the line. But at this point, at least I'm happy to report there wasn't any bacterial contamination in those residential wells, so that's a positive thing. Update you a little bit more on the PFAS. So we had the investigation going on in Hillsdale County around the landfill out there. We had Eagle had taken a couple of samples a while back, didn't find anything. In those first round of samples, they decided to expand the sampling areas. They did 4 more homes, 4 more residential wells. They tested it for 1,4-dioxane, which was the initial compound that was found in a well that started the investigation, and also for PFAS. So at this point, the last report that I got, they had the results back for the 1,4-dioxane from those 4 homes, and those were all negative. We're still awaiting the PFAS results, so I will update you on that as those results become available. The last thing I wanted to report on is that we have gotten some PFAS filters installed in the homes near the west side landfill. As you may recall, last month I reported that they did another round of sampling there. They expanded the area. They found a couple of more homes that had some compounds. They were still under the health limit, but still providing those folks with a filter. Had the plumber go out there and install those filters, so those folks are all set. And then in White Pigeon, we had provided water filters for all of those people when that testing was done a few years back. One of those people, one of those homes, the people decided that they didn't want a filter. That house sold, the new people got in there, they did want the filter. We've got that filter installed. And then we had one of the people that had a filter, their home burnt down. They rebuilt, and we're installing a new filter for them as well. So that's all I have.
Any questions for Paul? Commissioner Matthews.
Mr. Chairman, I do not have any question. However, a business person from Union City contacted me last week and thanked the health department, especially your area, approving the septic tank permit on time. So thank you.
Yes, Mr. Laney.
With this new software that you've got, previously, were records kept on paper or digitally, or how were you keeping records?
Okay, so
Previously.
a lot of the historical records were still on paper, and we were in the process of scanning and getting those digitally. And so all those records that were scanned and gone digital, we're uploading those to the new system. We still have a vast amount of well and septic records and stuff that are still in the paper form that hopefully we can eventually we can get those. I mean, there's thousands and thousands of records, so we hope to get those scanned in, all those historical records too. But and then all the food, the food inspections and such, those are all digital. There are some that go way back before we had the computers that are still paper, but we have most of those digitally now. Anything new is digital as well. And we hope to have part of this system is we're going to have a portal so people can actually go in and look up their own records, which will be great. It'll really save our clerks a lot of time. They spend so much time every day, people inquiring, where's my, I want a copy of where my septic system is, or this or that. They'll be able to go in and actually retrieve, if we have it digitally, they'll be able to go in and retrieve those themselves, which will be huge benefit for our staff.
So the new software is really proven out to be beneficial.
Absolutely. Yeah, it's great.
Good. Great.
And Paul, you're gonna have those records for the septic systems, right? Well stuff, are you gonna keep those locally or just refer people to the WellLogic system with?
They'll be able to get access to WellLogic through our software, through the portal.
Okay. other questions for Paul?
Mr. Chair,
Yes.
can you address any new ownership or any new businesses in our tri-county area?
Oh, okay, yeah, there was, two new, businesses that changed owners, and those were, I have to look at my notes here. Okay, Dickey's Barbecue here in Coldwater has a new, owner, and, what's the other one?
Subway and Sturgis.
Subway and Sturgis, yeah. So, two new owners. So, I always like to put those in my written report, encourage everybody to support those new business people. So, you know, we like to keep, local business people supported, and I think it's really important, so.
I know we've got one new restaurant coming in Hillsdale, and well, technically, 3 new food or beverage type facilities coming. We've got a pizzeria coming, we've got a bakery that's in the process of getting built and opened, and then another brewery tasting room.
Oh, okay.
So I don't know.
The bakery might be, licensed through, MDART,
Okay.
yeah. The other ones would be licensed through us.
It's nice to see cars back at Dickey's parking lot. Amazing how people can destroy a restaurant.
All right. Hearing nothing else, we will move on. Item 6, financial reports.
Good morning. So first off, you have the bills before you totaling $349,386.27. I would be happy to answer any questions you have about those bills.
And if there are questions or not, I would entertain a motion to approve the bills as presented.
Make a motion, we pay the bills as presented.
I second, please.
Motion by Commissioner Baker, second by Commissioner Matthews to approve the bills as presented. Is there any further discussion or questions for Teresa on those? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried.
Thank you.
6B, monthly financial statements for the month of, as of May 31st are in the packet.
Yeah, so you have the balance sheet and the expense by programs. So currently we are running 10.81% under our budget, but we are bringing you a budget amendment to the later in the meeting. There are a few programs that are running over that we are monitoring and that will be addressed in the budget amendment coming forward later in the meeting. I would be happy to answer any questions that you have.
Any questions or motion to accept and approve the financial statements for May 31st?
Move to approve.
I second.
Motion by Commissioner Howard, second by Commissioner Matthew to approve the May 31st, 2023 financial statements. Any further discussion? Hearing,
Baker's on a roll, so I didn't want to interrupt.
hearing none. All those in favor say aye.
Aye.
All those opposed, motion carries.
Great job, Orange County.
Committee reports. In the packet is the minutes of the Finance Committee meeting from June 19th. Commissioner Houts, any highlights from that you want to?
No, we'll be probably going over the, we moved a few to do the budget amendment for 23. We're looking at the 24 original budget. That will be also brought to the whole board. And then Sturgis lease was talked about. And they're going to redo the lease over there for Sturgis as we're getting more space. But other than that, that's the only thing I have to report on until we bring the full motions to the board.
Okay. Then I get a motion to approve the Finance Committee meeting minutes as presented.
Move to approve them.
I'll second.
All right.
Motion by Commissioner Howard, second by Commissioner Lanius to approve the Finance Committee meeting minutes of the June 19th, 2023 Finance Committee meeting. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Program Policy and Appeals Committee meeting minutes from June 21st. Commissioner Matthew, any highlights on that?
Yes, thank you, Mr. Chairman. First of all, I want to thank the committee coming together yesterday, and we had a very interesting meeting. First, we discussed about the AAA Advisory Committee appointments. Then we discussed about the accreditation reports. Mr. Chairman, the Accreditation Commission's report, we have received, as Health Officer Ms. Burns earlier indicated. I believe we received the highest status commendation. So, Mr. Chairman, I'm grateful to our staff and the directors, and they are very impressed in Lansing. And yesterday I mentioned we have a unique department, Tri-County Department, under the leadership of Ms. Burns and the Area Agency on Aging with the Health Department, so very unique. Thirdly, we have discussed on the community health needs and assessment and community health improvement plan, which extensively the health officer described yesterday. Those are the highlights.
And can I get a motion to accept those meeting minutes as presented?
Yes, Mr. Chairman, I move that Program Policy and Appeals Committee is June 21st, 2023. Records will be approved.
Second.
Motion by Commissioner Matthew, second by Commissioner Baker to approve the June 21st, 2023 Program Policy and Appeals Committee meeting minutes. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. All right, item 8A, new business. Area Agents and Aging Advisory Committee appointments, and we have an appointment to deal with. That was discussed at the Program Policy and Appeals Committee meeting. We have a name in front of us of Sandra Leslie.
I'll make a motion to approve the appointment of Sandra Leslie to the AAA committee.
I second.
Motion by Commissioner Baker, second by Commissioner Matthew to approve the appointment of Sandra Leslie to the Area Agents and Aging Advisory Committee. Any further discussion? Commissioner?
Mr. Chairman, Miss Leslie's interests are bowling, singing, meeting new people. I wonder if she will be able to come down and sing for us.
We'll see if her schedule allows.
She didn't say she's any good, she just enjoyed it.
We'll see if we enjoy it.
Yeah.
Hey, the Lord said, make a joyful noise unto the Lord. He didn't say anything about being on key.
Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Letter B, 2023 fiscal year budget amendment number 2. And that is before us.
Teresa, you have
Yeah. So this is our budget amendment number 2, largely provided to you by Brene, who's done the lion's share of the work to get this ready for you. You will see that this budget is an increase of $473,669 from the last amendment that we made, which is if you look at page 40 and 41, the green columns are what we are proposing in this amendment, and then just to the right of that on page 10, you'll see the difference column of what we added or subtracted, and then you'll see a column for what budget amendment number 1 or the current budget is. So you can see pretty quickly by looking, we've moved some money around here, and we have added that $473,000 to this budget. And then if you want the detail of how that fits into every single one of the programs. You'll see that detail on page 42 through 49. This budget does include $163,036 of designated fund balance. We're trying to spend on some of those monies that are sitting out there waiting for us to use them, that can only be used in specific designated areas. So I would be happy to answer any questions that you have, or if Brene to also help me with that.
So revenue is going up by the 473,669, and expenses are going up by the same figure?
Yes.
They've moved some money around. Steve and I went over this quite a bit the other day, and she answered all the questions, so I move that we accept the amended 2023 as it's a working budget.
I would support that.
We have a motion by Commissioner Houck, second by Commissioner Lanius to accept the budget amendment number 2 to the 2023 fiscal year budget. Any further discussion?
I have one comment.
Yes, Commissioner Lanius.
Going forward, can we get larger print?
For sure.
We can do that.
We might have to use a few more pages.
Well, I've already got trifocals. I don't think there's room for another line.
The doctor to the right might be able to help you with some of that.
Well, you should have.
That's right.
If no additional discussion, all those in favor of the motion to accept the budget amendment, say aye.
Aye.
All those opposed, motion carries. Next, the fiscal year 2024 original budget is before us.
All right, the same stuff applies. Brene has done the lion's share of the work to present this budget to you. This budget is a reduction from what we have in our budget amendment number 2, because we don't have all of our awards for next year, and there are certain dollars that we aren't sure if we're going to get, and we also don't know a full picture of what our expenses are going to be. This is our first stab at a budget amendment, or an original budget. We'll bring you a budget amendment in January that we think is much closer to reality, but with the information that we have available today, this is the best that we can do, and we have to bring it forward so that we can meet our deadline to get it back to the state in July. Happy to answer any questions.
And I'll say again, Steve and I went over this again at the meeting. It's a budget and it works. We did discuss maybe what to be asking the counties for their increase this year. Might be coming in another month or two. What our part of our share would be. So I move that we accept this budget as presented.
I will support that.
Then moved by Commissioner Howard, second by Commissioner Baker to accept the fiscal year 2024 original budget as presented. Any further discussion?
Well, me.
That was me that seconded.
I'm sorry, Commissioner Howard, Commissioner Lane is seconded.
And just choose one of us or 4.
You can just pick one.
Chair stands corrected. I guess the question I've got on this, where are we, and I didn't ask this, we have a fund balance. At the beginning of the year, end of year, are we expending any fund balance?
Yeah, so in this original budget, we have projected spending $116,000 of fund balance. And you can see that on page 59. In the right-hand column, there's some stuff that's kind of color-coded, and it would be the orange at the bottom that said designated fund balance.
Okay. And then Commissioner Howard, you mentioned potential county allocation number. Are we looking at an increase in that, or?
I am sure they'll be coming with the standard few cents to us, but I don't think that's been decided yet or worked out. But I think they got to meet with the county administrators, and they'll be back with something.
Any further discussion?
Well, again, this is a preliminary, so.
Well, once it's preliminary until we accept it, and then it is the actual when we start the year, and as Teresa
Right.
probably explained to you
Yep.
in the finance committee, it's hard to set a budget in July when you don't even know,
That's right.
or in June when you don't even know what you're getting for the year yet, so.
Exactly what I mean by kind of a preliminary.
Yeah.
Commissioner Caswell used to always refer to it as our Alice in Wonderland budget.
Yes, as we did last night at a school board meeting, accepted it, or approved a budget for the fiscal year that begins soon, and we don't know what we're getting for state revenue yet, so. That one's a little different, because our fiscal year begins July 1.
Wow.
So, any further discussion? Hearing none, all those in favor of approving the 2024 fiscal year original budget, say aye.
Aye.
All those opposed, motion carries. Next, letter D, Sturgis office lease.
Again, and I'll let Teresa probably take this over, but it was fully discussed and seemed very reasonable, and, what we're getting out of the building and what we're paying, take it away.
Certainly.
Do you want to know it, or would you like?
I'm gonna let you, because you ran this through finance.
Yeah,
Right.
so, the landlord at the Sturgis office has come back to us and asked for a change to the current lease that we have. We have a long-standing relationship with this landlord, and, not only do we have the space that we currently have with them, that we've had since 2017, but prior to that, we had space in a different area in town with that landlord, and we have a good relationship with that landlord, and we have always been treated, in our view, very fairly by that landlord. And the landlord is in a different situation now because of all of the things that have happened in Sturgis with the hospital closing and all of that. So the landlord is asking for some concessions and to open up that lease. We feel like this is a good compromise that gets the landlord a little bit of assistance from us and puts us in a position to move forward in the future. The landlord is asking for us to change the lease from the lease that we have to a triple net lease, which would add $1.50 per square foot to the space, which equals out to $199.75 a month at the once we occupy the additional space that they're building out. And for the 4 years remaining on the lease, that equals less than $10,000. And the landlord is investing $22,000 of their own money to do the build out for that additional space for us. So we do feel like, I mean, ultimately, best case scenario is we keep what we have. And we don't have to pay any additional and take on utilities, but they need some concessions, and I think that we're gonna pay for it now or we're gonna pay for it later. So in order to preserve that relationship, I think we are money ahead and to just go ahead and make those concessions and accept their changes.
And refresh my memory, what other costs besides the lease do we have there? We're paying no utilities,
Yeah.
other than phone lines and mini-gas.
Yes. Currently, we pay none of the utilities other than the telephone, and we have the lease. So going forward, we will have a gas bill, an electric bill, a garbage bill. Seems like I'm forgetting something.
Well, the phone bill, but we
Right.
already have that.
So we will be assuming of the utilities as well for our space.
And the value, we'd have to pack up and move to a new building with more expenses. I move that we accept this, new, satellite clinic lease amendment, I guess it'd be.
Second.
Motion by Commissioner Houck, second by Commissioner Baker to accept the revision to the Sturgis lease as presented. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Letter E, the accreditation report.
Yeah, so we run over these reports in program policy and appeals. They are available to you, as I mentioned earlier, on our website. And so you can't see my computer screen, But if you go to our home screen, bhsj.org, and then scroll down to the bottom, there is a section for Board of Health, and if you click on the Board of Health resources, you will find the BHSJ Cycle 8 accreditation site report listed there. And really, I mean, I already talked about this during my health officer report, so unless you have questions, I don't think there's anything more to say today about that.
Or for those that are on the finance committee, if you want a more detailed explanation of it, go out and watch the Program Policy and Appeals Committee video, because Rebecca, I went over that quite in detail some more at our meeting yesterday. Any questions about that accreditation report? There is no action needed at this time. Nope. Letter F, Community Health Needs Assessment and Community Health Improvement Plan.
All right, so one more thing that we talked about at Program Policy and Appeals. We did hire a contractor to help us with this work, and he has now wrapped up, as I mentioned earlier in this meeting. This report is also available on our website under the Board of Health Resources tab. So this information is available for you as part of the health improvement piece. So there's two parts. We collected a whole bunch of data, we analyzed the data, we're presenting the data. Then we put together this health improvement plan that takes into account the data that we gathered, the conversations we had through focus groups, and then our best effort at what we want to focus on during this period of time that these cover.
If I might, I did put this at their table.
Oh.
It was not part of the packet, but it's the improvement plan. It was at your table.
Yeah, there's a separate handout that.
Yep. Thank you, Teresa.
Sorry.
That's fine. So, so that as part of the plan, I guess since we've got it, if you go back to page 8 of that document, you will see really what amounts to a work plan. And these are the target areas. They provide information about, who's going to be most responsible, which, I mean, really, at the end of the day, it's us, but where we're gonna check in at, who's doing that, when we're gonna do that. And so that is all detailed on pages 8, 9, and 10, and then on page 11, if we determined that there was an area that we missed and we want to add it on as a new project to our health improvement plan, it provides us with the opportunity to add something on. So Alex is still here. He was in attendance, like I was, at all of the presentations at our human service groups. He actually did the presentation at the Branch County group because Marcus was not available. He did a great job. Really, the only thing that we had some comments on that maybe people had wished there was some talking or work to be done included senior health. Do you remember what the other one was?
Transportation.
Oh yes, transportation. So.
And mental health, like walking.
Yeah, thank you. So they're complete at this point. The contractor is done. We have things we need to work on now. We will get this into our performance management dashboard, and we will continue to work these efforts, hopefully, and see an improvement in the health of our communities. So that's all I have on that.
Any questions regarding the Community Health Needs Assessment and Health Improvement Plan?
I forget who was headed by.
Marcus Cheatham is who we hired to do that work. Yep.
And this is just a evaluation, we're not taking any action on it yet.
No, it's really, I mean, it's for your information. I wanted to report back. I mean, you did approve us to hire him to do this work, so I wanted to come back and say, this is what we did, this is the result, and and hopefully you find it to have been a worthwhile endeavor.
And I think today there's no action, but in the future, there may be some action that we may have to be presented with as the Board of Health to help implement that action plan. All right, next, letter G. MERS actuarial report. I'm gonna turn this over to Teresa. That is in your packet.
Yeah, so we received our MERS actuarial report just a little over a week ago. And it was not as good as we had hoped it would be, but it was not as bad as what we expected it to be either. You will see that on page 73 of the packet, the funded ratio actually went up by 1%, which we feel like is really good given what the market performance was. And we will have a thorough presentation of this report from our MERS representative, or she's a regional representative, and she'll be presenting this information to you at the July meeting. Prior to public comment, she'll do a presentation for you in July. So I would like you to take some time to review this report, and if you have a specific question for Marnie that you would like her to address when she comes, let me know and I will send that off to her so that she can address it. Things that are noteworthy in here, on page 78 in the top figure in the right hand column would be what our payment is going to be for MERS for the year starting January 1st, and it has gone up approximately $30,000 from what we paid last year. And then you have these beautiful charts on the next page that show how payments are expected to go based on the actuarial numbers in this report. And then on the very next page, page 80 of the report, this chart, I like this chart because the bottom line of the estimated annual contribution, you'll see the first number is $103,320. That's what our normal cost would be if our plan was not underfunded. The $445,500 of the payment is going to the underfunded liability. So that's what makes up this payment of the $548,000. So that's interesting because, you know, we would, if we hadn't closed the plan and we didn't have issues with them not projecting appropriately in previous actuarials, we would not have nearly the large payment that we have today.
Well, yeah, I would say part of that underfunded liability is also because of it now being a closed plan and new hires not going into that plan, and so their salary is not being calculated in the contributions for that, so.
Yeah, it is a very mature plan. I think today, this report will tell you that there are, on that page.
No, it's early on, but it's also one of the last pages here. Page 90 and 91. It kind of gives us a brief overview of that. 133.
Yeah, so this does say there's 21 active employees, but we've had several retirements since then. I think we currently have 17 active employees in the plan. So I would be happy to answer any questions that I can, although I am not an actuarial, and there is a lot of information in this report that I may not be able to answer your question.
And again, Marnie
Daggett.
Daggett will be here at our next Board of Health meeting to better answer any questions about this report. I do have some that I'll get to you. I recently received another merge report that I kind of want to compare them side by side to look at some of those differences.
I think the board did well by heavily funding the last few years to get us that 93 or 94%.
Yeah, and you can see the amount of money that this board has committed from the agency that was over and above what we were required to. If you look at page 84, it would be the third column. which would be the additional contributions. And that shows the history of the additional contributions that we made. We've been very dedicated as an agency to make sure that we fund this plan and we get it fully funded as soon as possible. And we've been very well supported by the board in our efforts to do that, and we thank you for that. And if we have extra money that went unspent at the end of this year, I'll probably be coming back to you and asking you, can I send them some more money? Right now, I'm not projecting to have that, but if things happen and that's where we are, that's our top priority.
Any other questions on that actuarial report as it was presented? Hearing none. That brings us back up to public comment.
Hearing none.
Hearing none.
Move to adjourn.
I said.
Motion by Commissioner Howard, seconded by Commissioner Matthews to adjourn. All those in favor say aye.
Aye.
All those opposed? Motion carried.